And we all know that you can't change behavior from the top down. You have to change behavior by having the staff be empowered to change it by feeling that they own that change. And they have to have a role in the change. So they have to have their perspective introduced into the change process.
Including the perspective of those involved will make it more likely that your plan will be practical. For example, in her assessment, a health consultant may have noted infrequent hand washing as a problem area. As the group develops an action plan, the consultant may suggest changing from bar soap to liquid soap, or increasing the availability of moisturizing lotion and paper towels at sinks. Caregivers might suggest rearranging the placement of furnishings in the room so that as the children move from play areas to mealtime, hand washing is more easily performed. The director might raise concerns about the cost of hand washing supplies. All of this input should be factored into the plan for improvement. A solution that doesn't address everyone's concerns is unlikely to solve the problem.
I try to have a two-way dialogue with the provider. I don't want to come there and just kind of dictate things to the provider or the director. I want it to be a give and take.
Child care providers and consultants are partners in promoting health and safety. To help you build a solid relationship, experts recommend that health consultants be aware of how your previous opinions about child care may affect a new relationship. Try to approach each new situation as an opportunity to learn about acceptable, alternative ways to meet health and safety goals. Health professionals and early childhood educators share a common interest in fostering the healthy development of children and families. The professional focus of early childhood educators is child development. Be supportive and accepting of perspectives that differ from your own. Collaborative relationships require a balanced exchange of information and shared decision-making. Respect is earned by supportive relationships coupled with performance, not by background. Directors and caregivers will watch how you conduct yourself in challenging situations. Partnerships involve give and take, so be prepared to try new ways of doing things. Take time to think about what you have seen and heard before offering suggestions for significant change. Use Caring for Our Children as a reference tool to prepare for presentation of your recommendations. Present information in language appropriate to the caregiver's education and experience. Your success is based on whether your advice fits the situation and the people who will implement it. Be prepared for meetings or consultations. Preparation inspires confidence. Everyone has busy schedules. Child care providers will appreciate that you have taken the time to organize your input. Make a habit of saying something positive about the teachers, the children, and the program. Everyone likes positive feedback. Criticism is more easily accepted when it's constructive and combined with praise.
What I try to do is give a lot of the positive things that I saw in the center or in the room for that day. Because remembering that everyone wants to do a good job, and the thing that may hinder them doing the best job is just a lack of knowledge. And I try to have a two-way dialogue with the provider. I don't want to come there and just kind of dictate things to the provider or the director. I want it to be a give and take. We're not the police. We're really, you're just an observer. And you make your suggestions and recommendations based on your observations.
Be to say you do not have the answer. Many problems don't have simple solutions. You can discuss how you might do research to look for an answer. Often, there is not one right way, but several acceptable ways to solve a problem. A collaborative team spirit should be at the heart of all caregiver-consultant interactions. Rather than presenting a list of recommendations or areas that need to be improved at the start of a discussion, a child care health consultant should work with child care staff to develop a list of what the child care staff thinks should be improved. In most cases, the list developed by the staff will have some points in common with what the health consultant wants to recommend. These common points are a good place to start to create successful action plans. The key to achieving successful outcomes in problem-solving sessions is structure. Structured sessions help engage everyone's best thinking. Discussions should be designed in a way that keeps the focus on solving the problem, not who is at fault. Since structure is so helpful, let's look at the 6 steps that help establish and implement a successful action plan. Step 1. Define the problem. This seems straightforward, and in many cases it is, but make sure there is agreement that the problem exists and why something needs to be done about it. The director may understand the need for change, but the staff involved in the problem may think what they are doing is appropriate. For example, diaper changing always requires a hand-washing sink.
When the teachers were finished diapering the children on the diaper changing table, they had a spritz bottle with soapy water in it, and they would spritz the children's hands and have them rub them together, and then they would just dry them off with paper towels and then have the children get down from the diaper changing table. And that was the extent of the hand washing. The teachers also were doing the same thing, using the soapy water from a spritz bottle on their hands.
Step 2. Identify who is involved. Caregivers who have some responsibility for the problem need to be involved in developing a solution. Identify who has the authority to implement changes that may be involved in solving the problem. New equipment may need to be purchased. More staff support during diapering may be necessary to provide the time for the diaper changer to wash her hands without leaving her coworker with too many children to supervise.
I guess the most obvious choice would be to put plumbing in with a sink with hot and cold running water. But because our classrooms are set on a concrete slab, there was really no way that we could run water lines and have a drain system in the classroom. So we had to go think of something more creative.
Step 3. Gather input. Ask those who were identified as involved in the problem in Step 2 what they think needs to be done and what changes might work.
You need to check with the people who are going to be implementing it about the consequences of your advice to them. Those who are affected by the problem are probably best able to tell you what they think the problem is. You may disagree, but you need to hear what they have to say. And they need to have a say in what the solution is, or they will not own it and implement it.
Step 4. Identify gaps in information about the problem. During a hand-washing discussion, caregivers might point out that even though there is a sink in the hall, they can't supervise the children in the classroom if they step into the hall to wash their hands. Step 5. Help staff assign and facilitate task assignments. Now, everyone who is involved must agree about who will do each task.
One of our maintenance staff actually who camps realized that there was a mechanism that he could buy from a camping store that is frequently used in campers, and everything now is self-contained. There's a water source under the sink and a bucket for the water to run into, and it's a siphon actually, so there's a lever and the water is pumped and it continues to run while it's pumped.
Members of the child care staff often come up with innovative ideas. Portable sinks are available from camping stores and from suppliers who sell their products through the internet. Step 6. Help staff set timelines and decide who will check the status of the tasks that were assigned. Determine a reasonable amount of time for a solution to be implemented.
Well, you know, the center had a wonderfully creative solution in using a camp sink, but it wasn't quite right because the connections didn't hold up well and because it required manual pumping. So we went together to look for whether there was a commercial product that would accomplish this, and found one. Not too many manufacturers make it, but we did find one that was a portable sink that could be rolled along, filled from a sink and emptied with the wastewater into a sink and kept in the classroom. It was a far more effective solution because it self-pumped. You needed only to plug it into the wall, and it warmed the water so that it has features about it that make it much more useful and a little bit more sanitary. But the solution, really the concept, was thought up by the program. What I was able to add when I checked back with them and found some of the problems was to go and search for something which would take their idea and make it even better and make the implementation of it accomplish what we had really set out to do in the first place.
Successful problem solving often involves negotiation. As a negotiator, child care health consultants need to listen to other points of view and accept differences in perspective. These differences can sometimes be narrowed by asking for a clarification. As people with a differing point of view restate their position, listen carefully for any elements of common ground that could be used to work toward a solution. In talking through a problem, emphasize the use of we and us in discussions, instead of I and you. Work hard to keep everyone focused on the ultimate goal, creating a safer, healthier environment for children and staff. Be patient when problems reoccur or are not solved right away. Check at intervals what the program staff considers their top priorities. Remember that child care providers have many demands and limited resources. By developing an action plan with substantial caregiver input, a child care health consultant can help the program make timely progress in improving health and safety.